I am a survivor of COVID. I was diagnosed with long haulers and ultimately had no hope, but now I have hope because I have been to Dr. Jones at Tanner Clinic and his office, and he figured out what was wrong with me. I work in all the different hospitals now. I actually do medical sales. I sell supplies. So I've been in the medical field for the last 24 years, bedside nurse for 12 years, working oncology, ICU, OR, labor and delivery. So I've been all over the place, and I'm a hustler. I run around all over the place. I do in-servicing hospitals, so I've interacted with a lot of patients that have had COVID. So I got my vaccine back in March of 2021. Both vaccines did great, and then all through the summer was perfectly healthy and very active. I've got 4 kids, so I got to keep up with them. And so then I got sick the end of August. Our whole family did, 1st of September of 2021. And that's when everything just we were super sick with fevers. We all had different symptoms, and mine, I was just achy from head to toe. And eventually the aches went to my joints, and then my joints swelled up, and it was my knees, my elbows, my wrists, my fingers. And I'm like, what is going on? I thought I was having maybe an anaphylactic reaction. So I go into a family doctor, and I've always been healthy. I've never had to go to a family doctor, so I had to find one. And so I went into one, and he said, let's put you on some prednisone. So I was on high doses of prednisone for about 9 days. Felt great, could move around, I wasn't in as much pain. As soon as I was done with my round, it came back with a vengeance, and I ballooned up. I swelled up put on about 10 pounds worth of fluid. And it was, again, my knees, I couldn't even wear tight clothes or they would balloon up even further, and it was kind of crazy. So my family doctor referred me to a rheumatologist. Went into the rheumatologist. I had all the classic signs of RA, rheumatoid arthritis, or lupus. So he ran the tests, everything came back as clear, but my CRP, my SID rates were high, saying I had inflammation. And I'm like, well, you can see it in all my joints. And it was excruciating pain to move around. I felt like I had glass in all of my joints. I could barely move from my bed to the bathroom every single day. It just hurt. I've never been in such horrific pain. So I wasn't active for a long time, and if I did too much activity, it would make it worse. If I did too little, it would be worse again. And so rheumatologist was like, we're gonna just do a shotgun approach here and just put you on some methotrexate to help with the RA, which he was saying that that's what it was. And I began to have other symptoms with my eyesight, with my heart. I started having PVCs, flutters in my hearts and stuff. I had weird symptoms where I felt like I had bubbles in my veins, in my legs, and my skin burned, like as if I had sunburns. And I started having hives all over the place, rashes, and just crazy things that were going on. I just was spiraling down is what it felt like, and I felt like I had no hope because I was going to doctors, I was going to neurologists, orthopedics, trying to figure out what's going on. I went in to the ER a couple of times, and I felt very desperate to try to get some help. My blood pressure was high. I was in a lot of pain and nothing was helping. I even went to holistic doctors. I did holistic type stuff with oils and just a lot of different remedies to try to fix it, and even anti-inflammatory diets and stuff. Nothing seemed to touch it besides prednisone and an occasional chiropractor adjustment with my neck because I couldn't move my neck. And the ER doctors over and over again told me, go home, just wait it out, it's all in your head. And I was very, very frustrated because I knew something was wrong, and it was more than just rheumatoid arthritis. I knew it had to be linked to COVID. And so I found a new family doctor. She referred me to Dr. Jones, and she ran some tests and saw that my iron was low. That's why I was so fatigued. And she says, let's get you better. That gave me hope. Met Dr. Jones, he said, let's get you better. And that gave me even more hope. I've never been so depressed as I was when I was going through COVID, didn't have any hope, was turned away by the ER doctors. And I'm a nurse and felt like I am in the medical field and I should, get the help that I need. And I just felt like nobody would listen, nobody would hear me, nobody even thought that it was a real thing and that it was in my head. They kept saying it was in your head, it's in your head. And I'm like, no, you can visually see I'm ballooning up and my ankles are so swollen, and they thought I had congestive heart failure. All these random things of cancer, and ran all the tests, all came back. So It's all been targeted to COVID. I met Dr. Jones, he ran all these tests, he figured it out. He ran interleukin 6 and it was screaming high. And we had been up to the U of U, and because I had gone in because I had chest pains and my D-dimer was really high, so they thought I had blood clots, and that's literally what felt like in all my joints was blood clots. And yeah, they put me on a heart monitor and I was throwing some PVCs, and I was going up there to return my little device, and Dr. Jones called and said, "I think I figured you out." And I was ecstatic. I started crying because I was so happy to hear that I have help and somebody would listen to me and take me for reals. He said, "I ran these tests, this is what it is. I'm gonna see if we can get this drug." Specifically has a pass-through code for post-COVID, which, you know, a year ago, 6 months, let's see how long it's been, about 9 months that I've been dealing with all of this. 6 months ago, like, none of the insurance companies would have any codes for reimbursement for post-COVID patients. And so it was very hard to get anything approved through the insurance companies. And so Dr. Jones was very adamant about working with the insurance company, talking with them, doing a peer-to-peer, letting them know, painting this whole picture of exactly what was going on, and the ER visits, and my labs were just all out of whack. And he proved to them my case, and they approved it. And I got my first IV infusion about 3 months ago and improved significantly over the weeks. I felt like I was back on prednisone. And I've just progressively gotten better and better and better. And yeah, he gave me hope. I still have a little bit of residual pain here and there, and of course it took me 9 months to get to this point. So eventually 9 months to, or less than that, to heal. I felt like it has, I mean, I can close my hands. I mean, I couldn't even drive. I couldn't look in my rear view mirrors. I couldn't, there were so many things that I couldn't even comb my hair, or let alone hold up my phone to my ear because it was so heavy. It felt like I had glass in my joints. I was very fragile and febrile. What was nice, my company worked with me and the hospital shut down during COVID, and so I was able to do a lot from home. So I made a lot of phone calls, emails. So I have been working throughout all of this, but to go out in person, just in the last month, I've been able to get around and, you know, go in service my hospitals and check in and, you know, help take care of my customers. It's kind of an unknown right now. So I'm unique because Dr. Jones and I, as we were looking, there's nobody that has been treated outpatient that we know of right now that has been treated outpatient with the medication, the IV infusion. Several of them were in the ICU, pretty much on their deathbed, and they were given this when they were noticed that their interleukin 6 was high, and it targets it and it brought it down. So I'm kind of a, you know, month by month scenario. So I just am very, very lucky to have been, you know, referred to Dr. Jones and his team. He listened to me, and I told him exactly what was going on. He believed me, he knew, and I told him, this has to be COVID-19 because I have been very healthy. None of these diseases, you know, for autoimmune diseases run in my family. And he listened to me, and he said, "Okay, let's run all these tests." And I even had a list of all these labs I wanted run, which I've asked other doctors to do, and unfortunately they didn't know what the results would be on those, so they didn't run them, but he did. And he knew exactly what it was, and it just was amazing to, like, a breath of fresh air, to be honest, of being heard, understood, taken serious, and fixed ultimately. So it's awesome. They really didn't diagnose me with anything besides just inflammation. Congestive heart failure. I was pre-diabetic, which I've never had issues with my blood sugars, ever. And my A1Cs were high for many months. I had insomnia like crazy. I couldn't sleep. And so that was one of the things with COVID because of the inflammation. So I finally got on something that helped me with sleeping. They ruled out all sorts of different types of cancers with the mammogram and ultrasounds, and I went to a hematologist to rule out blood cancers. I went to a neurologist to rule out MS. I went to orthopedics because I thought I had torn my rotator cuff because all my joints were hurting so bad. It's what it felt like, even though I've never done that before. So ruled that out. I've been to so many different doctors to try to figure out what is going on, and my labs were okay for 1 second, then the next round they were off the chart, all over the place, up and down, white blood count high, low. Yeah, I was a mystery to a lot of doctors, especially in the ER. But they said I was healthy enough and sent me on my way, and I knew I wasn't healthy. I knew I needed help. So the symptoms that I had were all my joints. I felt like I had glass in them. They swelled up, and I had heart palpitations. I had poor circulations. My hands went white as a ghost. They thought it was Raynaud's disease, but that ruled out. I had insomnia. I had stomach issues where my stomach always hurt. I felt nauseous. I had fevers, night sweats like crazy. I had nerve pain. I felt like I have neuropathy in my legs. And the vibrations, I don't even know how to explain it. I felt like there was like a humming vibration that was going on in my whole entire body. And you sometimes can't really pinpoint what the pain is, because I felt like I had brain fog. I still do. Or I can't think of things as quick as I used to. I mean, so many different symptoms. And I had all of these, went into Dr. Jones, and he knew exactly what to do. He got me on a regimen of all these different supplements, ran all my labs, knew what medications to target my labs to help bring them down, and it's been awesome. At 6 months, I was not able to bring my labs down, but in the last 3 months, they've all come down to normal levels, and my CRP, sed rate, and my interleukin-6. It affected them, you know, because they could see how much pain. Like I usually am just mind over matter. Okay, it's all in my mind. I'm gonna get better. I'm gonna get over this. And I couldn't do that. I couldn't just push through. And they saw, they're like, okay, mom's sick, something really bad is going on. So they stepped up to the plate and helped. Steve, my husband, stepped up to the plate and totally helped. I mean, you always do anyhow, but yeah, they just helped me out a ton. And my husband's like, let me just carry you. And I'm like, no, I'm gonna walk, I'm gonna do this, you know? And I pushed myself. I couldn't go up and down stairs. I mean, which is ridiculous, because I've ran Ragnar. I'm all over the place. I mean, I'm very involved politically with my community. I've been a state delegate. I've been a precinct chair. We've been back to Washington, D.C. We've helped with history tours. We've done so many things on top of being a nurse, running around on, all my shifts and all the units and all the hospitals. I'm just a hustler. And so to be devastated by not being able to move was, my world was flipped upside down along with my family. And so we just kind of took it literally minute by minute as to how are you feeling, what are you, and I would take all sorts of different types of medications, and nothing worked. There was a point where I was taking at least 30 pills a day, where I don't even take a Tylenol maybe twice a year for headaches. And other than that, I've always just been healthy. So it's been pretty devastating to go through all of this. But then again, now I'm so grateful because I'm healthier than I was 9 months ago.